What triggers dissociative fugue? Dissociative fugue is a fascinating yet complex psychological condition. It involves sudden and unexpected travel away from home, along with memory loss about personal identity. This state often arises as a response to extreme stress or trauma. But what exactly triggers this unusual phenomenon? One of the primary triggers of dissociative fugue is severe trauma. This can include experiences like sexual assault, violent loss of a loved one, or exposure to war and abuse. Unlike typical post-traumatic stress disorder, which may stem from a single traumatic event, dissociative fugue is often linked to complex trauma. This refers to repeated or prolonged exposure to traumatic stressors that can deeply impact a person's sense of self. When someone faces overwhelming trauma, the brain may dissociate as a protective mechanism. This means that parts of the self may become split off to help the individual avoid the full emotional impact of their experiences. In this way, dissociation acts as a shield against psychological pain. Extreme stress is another significant trigger. When the mind perceives trauma as too much to handle, it may disconnect from the event and even from its core identity. This psychological escape can lead to episodes of dissociative fugue, which can last from hours to days. During these episodes, individuals may lose their memory of personal history or identity. Interestingly, substance use can also play a role. The use or abuse of alcohol or certain drugs can induce fugue-like states. For example, alcohol-induced blackouts may resemble dissociative fugue episodes, highlighting the complex relationship between substance use and dissociation. While dissociative fugue is related to dissociation, it is more closely associated with complex post-traumatic stress disorder rather than classic PTSD. In PTSD, dissociative symptoms may include feelings of detachment or unreality. However, fugue states representing a more extreme form of dissociation, characterized by amnesia and unexpected travel. In summary, dissociative fugue is primarily triggered by overwhelming trauma and extreme stress, particularly from complex trauma. It serves as an extreme protective response, where the brain disconnects from memory and identity to shield the individual from psychological harm. Substance abuse can also contribute to fugue-like states. Recognizing these triggers is crucial for understanding the importance of addressing trauma and stress in treatment. If you or someone you know is experiencing symptoms of dissociative fugue, seeking professional mental health care is essential.